Rectus abdominis muscle. The rectus abdominis is commonly known as the six-pack muscle. It lies along the midline of the abdominal region. Nearly all movement of the human body requires a pre-movement contraction of the abdominal muscles to stabilize the posture prior to movement. The rectus abdominis functions specifically to flex the spine and to provide the intra-abdominal pressure required for various internal organ functioning. Let's take a look at the landmarks. We have the sternum and the pubic bone. The rectus abdominis originates on the costal cartilages of the 5th, 6th, and 7th ribs and inserts along the crest of the pubic bone. Contraction of the rectus abdominis produces flexion of the lower thoracic and lumbar spine. It also contracts to increase intra-abdominal pressure. The abdominal obliques and the psoas muscle are synergistic to the rectus abdominis, and the lumbar paraspinal muscle groups are antagonistic to the rectus abdominis. Associated symptoms for trigger points in the rectus abdominis muscle are as follows. This muscle is commonly referred to as the six-pack muscle. Clients will complain of pain across the back, at the iliac crest, and or the thoracolumbar junction levels, pain at the xiphoid process and the lower abdominal regions, and symptoms associated with dysmenorrhea, abdominal cramping, abdominal distension, colic, diverticulosis, appendicitis, or gynecological disease. These symptoms may be secondary to underlying visceral disease, or they could be completely unrelated. Some factors that may activate or perpetuate trigger points in the rectus abdominis muscle include new abdominal exercise programs, punching or kicking from a cardio kickboxing or a martial arts class, visceral disease such as peptic ulcer or intestinal parasite, abdominal surgery scars, impact trauma, constipation-related straining, extensive coughing, and emotional stress. Trigger points in the adductor magnus muscle, quadratus lumborum, and iliopsoas muscle are all associated with trigger points in the rectus abdominis muscle. Some common misdiagnoses for trigger points in the rectus abdominis muscle include appendicitis, gallstones, and dysmenorrhea.